But I can say that in the last 10 years, I have not seen any person from my practice end up having a cardiac event because of the lifestyle they chose. Like, in other words, they go on a fasting diet, they go on a diet that is devoid of refined carbs and sugar. They get into a physical exercise regimen. And I have not seen an adverse cardiac event as a result of that. I'm in a little protected space because all these people have done work for me ahead of time. And so when I go ahead and give my evaluation and come to a empowered decision with my patients, I would say that I'm in a little safer space compared to my colleagues. Now, over time, over the last 10 years, what has happened is that I have been referred either because of my YouTube channels or because of the talk that I gave at LowCarbDenver, which really was a coming out talk for me. Jeff invited me, and that talk has been viewed more than 1 million times on YouTube. So it makes me a little bit infamous. The patient population that is graduating to come towards seeing me are a group of people who are already motivated to do fasting, already motivated to cut out refined carbs and sugar, already motivated to exercise. So it makes my job easier. So I think that people who come to follow me are doing better metabolically in terms of cardiac events and in terms of their overall health, because it's a self-selected population that is now beginning to follow me a lot more than people who are sort of wanting to follow mainstream medicine advice, if that makes any sense. In the beginning, when I used to do it, I got reported to the medical staff that I'm doing something illegal. People wrote that this is a patient of this physician who's presented with a cardiac event to the hospital without a statin. And I wrote back saying that, yeah, but that was one patient. And there are these 10 patients of yours who have come to the hospital with a cardiac event on statins. Cardiac disease is multifactorial. There are so many variables that lead to heart disease, not just lipid profile, but stress, sleep, insulin resistance, inflammation. These are major factors. And I even keep telling them that tomorrow, if I end up having a cardiac event, you should not automatically assume that this is a low-carb cardiologist who is a practicing low-carb cardiologist himself, whose LDL levels range in the high 250s, whose triglyceride levels are low, whose HDL level is high, and his cardiac event was as a result of high LDL. As a physician, I'm exposed to volume stress. I have to see a large number of patients. I'm exposed to stress from taking care of patients in the cardiac cath lab, coming in with cardiac events, myocardial infarctions, dealing with life and death situations. My sleep can be compromised. So there are so many factors that can lead an individual to end up having heart disease. So one should be cautious and not extrapolating too much into one particular variable and say that's what is causing heart disease.